are happy to go ahead with our today's topic. And well, I just want to thank everyone for sticking up with us, and of course, just joining us and staying and being patient. It means a lot that you are still here. And well, I just want to remind you that we are gathering here every single day just to support you throughout this uncertainty. Although we know some of the clinics are already reopening, so those are positive news, and we are definitely waiting for all of you to be able to continue or start your treatments as soon as possible as well. And all those events are always brought to you with a huge help from our partners and ambassadors. And as always, I want to thank them because, as you know, without them, nothing would be actually possible. And well, tonight, you already know, we already had a previous webinar with Dr. Elias Tsakos. And today, this is another event with him. I'm very happy to have you back with us. And well, as you know, Dr. Elias Tsakos, he is the medical director of Embryoclinic, which is located in Thessaloniki in Greece. And tonight he will be talking about Greece, which is a world-class fertility destination. So he will be able to just explain why it's a world-class fertility destination, but also he will be happy to answer all of your questions. So all you need to do is just simply type those in the chat section, and well, then it's anything you have in mind, you can go ahead and answer. Please refresh your website, okay? If you could refresh, Dr. Elias, you can hear me, right?
Yes, absolutely, yes.
Okay, so please just double check, just refresh. Help. If not, I will try to help you in a second as well. Yes, perfect. Thank you for confirming that. And well, I think we can start. Dr. Elias, are you ready to start with your introduction?
Yes, absolutely, I am.
Excellent.
Okay, thank you so much. Thank you, Caroline, for organizing another webinar, and thank you to all the ambassadors and the people who've been backing this amazing project. And of course, thank you to all my my patients and the team who've been supporting through all of this. And thank you all for listening. Greece, world-class fertility destination. So I have about 20 minutes to make some points with regards to that. I will try to avoid the C word, the COVID word, but I'm afraid I won't be able to. So I warn you that I may have to mention the C word at some stage. I'm very pleased to mention that here in Greece, we're all functional. We have been functional for quite a few weeks now. We have been following the European Society of Human Reproduction guidelines, which have been topped up by quite intense guidelines given by our local health authorities and our fertilization authority here in Greece. So we have been treating patients. We have been looking after our fertility patients from Greece mainly. We haven't accepted any international patients yet. However, we have got some bookings starting from the 15th of June onwards. So the 15th of June is the official first day of international patients arriving into Greece. And of course, we can speak a little bit more about it later if anyone is interested. Now, why is Greece a world-class fertility destination? Up until now, I had 6 reasons why, so I can go through that list with you, but now we have a 7th reason, which is related to the C word. So quality is number 1 reason, in our opinion, and quality includes safety, and safety means medical safety in terms of having the facilities to look after our patients, and fertility safety, which means that our fertility clinic are quite well equipped to manage all the cases, and of course the country safety. And quality also reflects onto success and the overall experience. Of course, I will have more time to elaborate on that. Number 2 is access. Number 3 is the legal situation. The legal framework in Greece is such that is allowing certain types of treatment which are legal and regulated. And of course, costs are also an important factor that makes Greece quite tempting for quite a few international patients from across the globe. Egg donation is a separate reason why Greece is attractive to many patients from all over the world, and I will elaborate on this a little bit later. And surrogacy also is a factor. Surrogacy means that a lot of patients from all over the world find Greece as the only destination in Greece in Europe which is legal and regulated. So let me just have to speak with my colleagues who are just busy all over the place here. Συγγνώμη, Λέκτα, κλείσαμε την πόρτα σου παρακαλώ. I'm very sorry about this. We're still working. It's 8:20 in Greece p.m. and we're still running a very busy clinic. Κλείσε μου τη δική μου πόρτα, Λέκτα. Sorry about this. Now, the number 7 reason is the COVID situation, which makes also Greece attractive. And this is simply because Greece has proven to be a very safe destination with regards to the COVID situation, where we managed to keep the virus at bay. We've only recorded less than 180 deaths overall, and we've only had less than 3,000 cases recorded until now. This is mainly because of the early lockdown, and Greece has been out of lockdown now for nearly 1 month. So this is the outline of my talk today.
Perfect. Thank you so much for that introduction, of course. And we will now go for the most common questions. And then, of course, it will be time for your questions. And those are coming up very fast as well. So I'm very glad to see that. And so the first question is, so why is Greece a world-class fertility destination?
Yes, I will elaborate a little bit more about on quality. Quality includes a number of factors, and this is safety. I mean, of course, give me 1 minute, please, because I have to do a little bit of homework here. 1 minute. Okay, sorry about this. So quality, in my opinion, is 3 factors. 1 is safety, number 2 is success, and number 3 is experience. So we are focusing a lot on safety. And we are looking into safeguarding our facilities and safeguarding our practices. We do practice very safe medicine in terms of avoiding unnecessary risks. We never perform pickups, for example, without the presence of the anesthetist. This is actually a legal obligation as well. I am aware that in many European countries and even in the US and North America, some egg collections are being performed without the presence of anesthetist, either with the use of local anesthesia or no anesthesia, or even a little bit of sedation provided by gynecologists or nursing staff. Here we do have consultant anesthetists present at any given time. The other factor is that in Greece, in order to be performing fertility care and fertility IVF treatment, you have to be a consultant. So we do not have research fellows or clinical fellows or associate specialists and so forth. With all due respect to those ranks of medical practitioners, I think the added provision that these consultants with proven experience in fertility are allowed to treat IVF patients may be another added safety measure. Now, there's a minimum safety number of staff that have to be involved at any given time. All of the IVF units in Greece have to be ISO standardized, and they do have to have an ISO certificate. Up until 2 years ago, we were required to have 1 ISO certificate, which includes the overall performance of our services, and that was the 9001 2015 certificate. 2 years ago, our health authorities instituted the requirement that we need to have a laboratory standards certificate as well, provided by an ISO company, and this is the Laboratory Standards Quality and Safety ISO. So all of the IVF units in Greece by law, we are required to have 2 ISO certifications, which ensure minimum standards of quality and safety. Of course, quality has to do with success. Now, success in Greece is high. There's a lot of reasons why this is high. I'm not going to go through each one of them individually, but what I have to say is that, of course, it is success, one of the factors that would bring more patients in. So most of us, and including Embryoclinic, of course, we do fight very hard to increase our success rates. How do we manage that? Of course, by doing a little bit more investigations than the standard ones. So, for example, we do have karyotype testing as a standard before we proceed to IVF for anyone using genetic material. Of course, the chance of having a karyotype anomaly is not very high in the general population, but please remember that we do have that we are dealing with a select population because most of our patients coming into Greece from abroad have tried locally. So we're talking about a high-risk population to be suffering from an unknown or an undiagnosed karyotype defect. Equally, we do investigate, for example, thyroid disorders. I mean, I do know that the overall incidence of asymptomatic thyroid disease is very low. However, again, in this select group of patients who have failed a number of times, the overall incidence of a thyroid disease, even asymptomatic, could be as high as 10 or 15%. So by treating simply the thyroid, we may increase the chance of pregnancy. This is only an example. There's a lot more examples of how we do insist on some standard investigation. I mean, we don't go very far, and we don't go very deep into investigating, for example, dubious situations and conditions. However, eliminating any uterine factors or any basic hormonal defects that may influence the result may make a difference. And of course, we are trying to optimize. The point I would like to make here is individualization. I think this is the way forward for medicine overall. I am absolutely in belief that there's no one size fits all. So a 37-year-old woman undergoing IVF who is probably 60 kilos in weight is not the same with the one sitting next to her in the waiting area. So we are trying to individualize as much as we can. And in my opinion, this is the future of medicine. The future of medicine is trying to identify individually what is the right optimum management and care for each one of our patients. And of course, the last factor is perhaps the experience factor. Most of the medical directors here in Greece, like myself, we do wear our blues and our theater gear all day. We do a lot of managerial work, of course. We do some scientific work. We are involved in the overall administration and management of the unit, but we also see patients. We also treat patients. We perform treatments and so forth. And ultimately, it's our responsibility that our patients receive the best care. So I think that having the most experienced person in the unit performing some procedures, especially in those difficult and those complex international patients that are visiting us, I think it's of paramount importance in order to achieve the goal of safety, success, and quality. Lastly, what I would like to mention is that especially, well, here in Greece and definitely at Embryoclinic, we do devote a lot of time on the experience of our patients. For us, successful outcome is not just achieving the goal of a single healthy pregnancy, hopefully first time round, but also to have a very positive experience. I mean, I can just mention here that we haven't been treating any international patients since the middle of March. However, our international team are very busy communicating, connecting, supporting, and advising numerous international patients all over the world in order to have them ready, alert, and prepared for the next step, for the time when it's right for them to travel and have the treatment.
Excellent. Thank you so much for providing all the details. And of course, let's have a look at the next question. So what about the quality and success of fertility care in Greece?
Yeah, sure. I just mentioned that. Sorry, Caroline, I skipped the first question and I went straight on to the second one. So I've just answered that.
Yes, of course, no problem, right? And what about the accessibility of fertility care in Greece?
Sure. Access is a big issue. Access has to do with how far or how near a country is to the country of origin of our patients. I mean, of course, we're in Europe. Of course, everybody or almost everybody has traveled to Greece, especially from the UK, many times. So we all know that access has to do with geography, with location. So access within Europe and maybe the Middle East is very easy, very simple. It's a flight maximum of 3.5 hours, 4 hours, absolutely maximum. So this is an easy access. But even from patients from further away, like the US or Australia, access is not difficult because by flying into Central Europe, like maybe London or Germany, then there's another flight straight into Greece. So we do have very easy access. I mean, most of the clinics, including Embryoclinic, we're only 20 minutes from the airport. So that facilitates patients from Europe to visit us even for a weekend. So if you fly into Greece on, say, Friday afternoon, by taking one day off, we can do consultation on Friday evening and then review consultation on Saturday, and then you can fly out on Sunday. So this is part of the access and the easiness by which Greece could be reached. Now, also, easy access to treatment has to do with waiting lists. I mean, most of us, and of course, including Embryoclinic, we don't have huge waiting lists. So if somebody books an online consultation, they can book in the first initial visit if that's necessary within the next 2 to 3 weeks. We can treat patients straight away after online consultations if they're having own eggs IVF, and we can treat them within the next 3 to 4 weeks after the initial consultations, and when we are happy that full optimization has occurred with regards to pre-IVF consultation, counseling, and so forth. With regards to egg donation, again, the waiting list is never longer than 6 weeks, provided that there's no particular requests for rare phenotypes. I will talk about egg donation later on, but as you all know, egg donation waiting lists could be as long as 6 months to a year in the UK, and of course this is due to the lack and unavailability of potential donors. Because of anonymous egg donation in Greece, and because of the fact that most of the units, including our own at Embryoclinic, we are in huge university cities, and there's a lot of donors coming forward, egg donors for donation, and of course this is reducing the waiting list for any treatment. Even in the COVID situation, waiting lists for treatment are no longer than 3 to 4 weeks.
All right, perfect. Thank you once again for answering that question. And what about the legal framework in Greece?
Yes, legal. I mean, Greece has always been a little bit liberal and a little bit pro-patient. I mean, we have managed to agree between ourselves, there's the scientists, the scientific societies, universities, health authorities, and the church to address the importance of fertility treatment for the patients. As you know, demographics in Greece is quite sad, quite bad. We have a fertility rate of 1.3 at the moment, coming out of a 10-year crisis. So we had to agree that we had to be quite liberal and we had to be quite pro-patient when the legal framework was decided. So in Greece, single women can be treated. There's no age limit for getting treatment up until the age of 50. Now there's a lot of discussions to push that limit over to 53. Our health authorities responded very swiftly to the COVID epidemic. So now there's a small increase in the age limit. So we are allowed to treat patients who turn 50 during the epidemic. So during the early months of March, they could be treated throughout the year 2020, even if they're just over 50. However, there's a lot of discussions, and we hope that before the end of the year, the age limit will be 53. Egg donation is legal, regulated, and anonymous. The anonymity of the donors is allowing a lot of young women wishing to donate for their own reasons to come forward. And of course, the patients, fertility patients from locally and from all over the world, they do have the opportunity to be treated with this means of fertility care quite readily. Now, what I have to say about the egg donation is that although the age limit for donors is 35, at Embryoclinic we use the upper age limit of 30. And so we don't accept egg donors over the age of 30, although it is legal. And of course, by having an egg donor in their 20s, we have a very important success factor in our hands. And of course, we're giving our patients the best possible solution by providing them much younger eggs than the average IVF clinic would provide, at least in Europe, as far as I know.
All right, excellent. Thank you so much again for answering this question. Next one is, what about cost of IVF in Greece?
Sure. I mean, costs are in general about 30 to 50% cheaper compared to the UK, and of course a lot cheaper compared to the US or Australia. We do have a lot of patients coming from the Americas and Australia, because given the huge difference in cost, as you probably know, in Australia and the US, the cost is about 3 to 5 times more than it is in Europe. So even if people take into account the flights, accommodation, and all that, they're still receiving a very good package, a very good deal for the cost. Now, so 50% reduction in cost is very important for couples on a budget, and now most, if not all of our couples, they are on a budget, because not only does it mean that they do save money, but they also have more opportunity to have more treatments for the budget. So this, the cost factor overall, if it's reduced, it increases the overall success rate, because the patients do have the opportunity to repeat the cycles in case they are unsuccessful. So the cost effectiveness overall is quite an important factor, and this is something that makes Greece very attractive. On top of that, of course, is the overall cost of living. So most of our UK couples, for example, although they do have the opportunity and the option to have some of their treatment or some of their investigation performed locally, I would say the majority of our UK couples, they prefer to fly out to Greece for the initial investigation, because they can complete everything within 1 or 2 days. And again, this can be very cost effective. And of course, by doing this, they familiarize themselves with traveling, the city, the clinic, and so forth. And that takes a lot of the stress out for the first official treatment visit.
Excellent. Thank you so much again for that. And there are definitely lots of questions coming up. So let's get to this one. So why egg donation in Greece?
Yeah, I did mention a few reasons why. One is anonymous egg donation, and anonymity makes it more available, because more egg donors, potential egg donors, come forward. So we don't have particular issues in recruiting egg donors. Although we're not allowed to advertise or look out or search out for donors, donors knock on our door, and we do have the luxury of choosing and picking the best ones. And as I mentioned before, at Embryoclinic, we only accept donors under the age of 30. So this is one of the reasons that makes the whole package quite attractive. Anonymity is another reason, of course, that makes a lot of difference. And of course, there's a lot of concern with egg donation, as you know, as to whether the donors are distributed amongst a small area, for example. So by having a selection of donors and availability of a bigger availability of donors, we do have the luxury of allocating, for example, one particular donor to the UK, and if they're successful, then the same donor to another country or to Greece and so forth. So by allocating donors to different countries, then we also minimize the risk or the potential risk of children and siblings meeting each other by distributing them into a huge geographical area. And this is one of the reasons also why international patients do prefer to come in Greece for egg donation. So, for example, a Manchester couple, they would be quite happy that the donor would not donate to Manchester or to London and so forth. And of course, we do offer 2 packages for egg donation, which is also very important. As you know, a healthy donor can produce up to 10, even more top quality eggs. So by having 2 packages, either full donation or mini donation, our couples do have the opportunity to choose a suitable package for their situation. I mean, for example, if a lady is in her late 40s and she only wishes to have 1 or 2 attempts, then there's no reason for her going into a full package and all that. So this is giving availability for cost-effective, individualized selection of egg donation packages, which is another attractive opportunity for our couples.
Definitely. Thank you so much once again for explaining that. And so what about surrogacy in such case?
Sure. Surrogacy is another reason why Greece is attractive. Surrogacy law in Greece changed a few years ago and allowed international surrogacy. And so now Greece is the only one European Union country in which surrogacy is legal and regulated, which means that it can be performed under a very, very strict legal and regulatory framework. And of course, surrogacy involves very complex procedures, which include, of course, legal procedures, court orders, and delivery of the child locally and so forth. So within European Union, I think it's quite important for the patients and the intended parents to realize that it is important not only to be successful with the IVF, but also to have a very successful, regulated, and controlled pregnancy and delivery, and also a very smooth return into their home country with the baby. And of course, this within the European Union is quite streamlined. Even with Brexit, with the UK, we don't expect any issues. As you probably know, Greece and the UK are very well connected together in the diplomatic and political, and of course in the relationship and commercial field. So we're hoping that no major issues would be raised even after the official Brexit. Now, another important factor that surrogacy is quite attractive in Greece for UK and international couples is that the court order is issued before we do the IVF procedure. So this is taking away all of the stresses associated with the court order issued after the delivery of the child. So even before we embark on IVF through gestational surrogacy, the parents are reassured, and they are the legal parents of the child that hasn't been conceived yet. So you understand that this is making the whole procedure much less stressful, and it's taking away a huge legal issue even before we embark on the surrogacy process.
Excellent. Thank you once again for explaining that. And now we will go to our final question when it comes to those most common ones. And this is indeed a very current question and very frequent. Why Greece is a COVID-safe destination?
Sure. I try to avoid the C word, but I do have to mention that Greece has been quite fortunate to have dealt with the pandemic in a manner that worked. I mean, as we all know, our responsible politicians and doctors, they made some calculations in every country. And we were very fortunate that the calculations made in Greece worked. And evidently, we had very low impact of the epidemic. I mean, I live in the north of Greece. It's been even better. I understand we've had something like 150 cases in a population of not deaths, cases. in a population of around 3.5 million. Overall cases in Greece have been around 3,000, 10 million, and we've had about 170 deaths. And if I remember well, more than 90% of them were high-risk population. So we've been very safe. I mean, today we had daily announcement from the Department of Health, and with 2 to 3 cases recorded in Greece every day, even since the lockdown was raised, the health ministry officials today declared that they would stop giving us daily updates, and that they were hoping that they will not need to give us daily updates anymore. On the basis of that, the whole of the country has opened now. We're back to normal. I mean, we do have our masks. I mean, I'm alone in my office. I do put my mask on when anyone enters my office and so forth. Of course, we take a lot of measures. I'm not going to go through to why this happened, but definitely Greece is a COVID-safe destination now. Now, in the IVF clinics, we take extreme measures to ensure that we're going to remain healthy and safe. We have instituted the PCR obligatory testing on anyone entering our premises for IVF. And in the IVF cycle, there's 3 COVID tests performed, and this is on top of the questionnaires and all the other measures that we have been taking. So any couple, before they start embarking on the IVF treatment cycle, so before they even start the injections, they have the first PCR test. And of course, prior to the egg collection or to the sperm production, we do check the women and the men as well. So by doing this, we ensure that the genetic material we're handling is COVID-free. For many people, this is over the top. I understand that in many countries, this cannot be performed for logistic, financial, and other reasons. But in Greece, it is possible. It is not hugely expensive. I mean, we have negotiated amazing prices for the COVID PCR testing, and we're even seriously considering into integrating at least or absorbing some of the cost between the clinics and patients and so forth. Bottom line is that no patient will undergo IVF without official testing through PCR genetic testing, which seems to be the most reliable at the moment. And this is because we want to ensure that our patients have this extra confidence that not only are they healthy before they embark on IVF or before they have implantation, but also that the fellow patients next to them are also healthy as well, and that the staff of an IVF unit are not handling specimens that may be potentially dangerous.
Perfect. Thank you so much again for answering that question. Excuse me. As you can see, there are plenty of questions from our patients already. So, well, let's get to those. And actually, you have kind of answered this one because it's regarding the COVID-19. So therefore, if you could take a look at this very first question. So what is the current position on Greece allowing travelers from the UK in terms of quarantine? Are hotels and restaurants open, and what are the rules of their use?
All right. Hi, David. Hi, Karen. Hi. Thank you for asking this question. Greece is open. The flights to Greece are starting on the 15th of June. Hotels are opening on the 1st of June for locals and on the 15th of June for international travelers. The problem is, what is the regulation in the UK? At the moment, the regulation in the UK is that when you return back home, you may need to self-quarantine for 14 days. However, there's a lot of pressure on the UK government at the moment, and we're hoping that this will be individualized depending on the country that you're returning from. So since Greece is not quarantining, is not requesting quarantine for the UK or the Italian or the Spanish travelers who in theory are higher incidence than we are here in Greece, then we would expect the UK government to allow you, if you're going back to the UK from Greece, not to quarantine yourself. However, this remains to be seen. So you can come into Greece, no problem. Of course, we will give you all our very strict guidelines. Of course, we will test you both for COVID, but please wait and see what is the situation going to look like upon returning into the UK.
All right. Thank you so much for that very first question and your answer. And actually, when we are talking about testing, there is another question, so I will just go to this one straight away as we are at this topic. The COVID testing prior to entering the clinic is not a free test, correct? What if you arrive in the country with own tests? I paid for the COVID test in Greece, €90 prior to discussion with the clinic. You said this is a negotiated price. What is the usual price?
Sure. Now, if you have your own test, put it this way. If you're having IVF, the requirement is that you have one test before you start the treatment. So the test, I mean, I can speak about Embryoclinic. I mean, we accept any test from the UK, absolutely any, whether it's an AMH or HSG or a pap smear or whatever, because we do have the means of course, ensuring that this is a reliable test and so forth. So if you have your COVID test upon starting, or just before you start your treatment, that's absolutely acceptable. Now, when, of course, when you're here and before there's a sperm sample or an egg collection, you will be required to have another test. Now, the €90 test, I'm not sure if you paid that in Greece or not. However, if you did, that's an extremely low price, and I'm sure it's been subsidized somehow. I'm not sure of the prices or what the prices are going to be until the first international patient comes in. I can't comment on that, but if that's what you paid for a PCR test, this is an amazingly good price.
All right, thank you so much. And actually, someone is typing, so I'm not sure if it's our patient. Well, let's wait and see. We will be able to come back to this.
If I can just comment, however, I'm yes. Not sure how I interpret prior to discussion with the clinic. I mean, we don't test anyone who's coming for consultation. I have to stress that. So if somebody's coming for consultation, and we have a lot of patients coming in for consultation, all we do is we do this intensive questionnaire. So we don't test anyone who's just coming for discussion. We would only test patients who are receiving treatment. They are in an IVF cycle.
Mm-hmm. Okay. Thank you for clarifying. Let's go. Okay, so this is an additional question. So prior to a potential egg collection, so Nicoletta has added here.
Yes, exactly.
Okay, perfect. Thank you so much again for that. And let's go to the next question, although there are like 3 of those right here. What tests do you do on egg donors and also women receiving fertility treatment through donor eggs as regards the womb if they have had implantation failure? Anything you can advise or add?
Sure. This is a whole seminar. With regards to egg donors, I mean, we do the standard test. I mean, basically whatever any female undergoing fertility care herself. On top of that, of course, we do psychological assessment, official psychological assessment signed by a psychologist. Also, in terms of genetic testing, we do karyotype testing, a full cystic fibrosis test. As you probably know, cystic fibrosis genes involve quite a big number of genes, and there's quite a few tests that test cystic fibrosis, covering anything between 50 to 99% of potential mutations. So on our egg donors, we do the 99% cystic fibrosis mutation test, and on top of that, we do the Fragile X genetic testing as well. Of course, all the standard testing and care, which includes pap smears. We need to ensure firstly the health of the egg donor, and of course, secondly, the overall quality. So a full hormonal profile, AMH, of course, blood groups. We do thalassemia electrophoresis. Electrophoresis is absolutely necessary for all our patients, And may I stress here that we also do that on every single recipient as well. So that's about egg donors. Now, implantation failure is a very huge subject. It's one of my favorite subjects because most of our patients do suffer from implantation failure, and even more are international patients. So I would be very happy, Anne, if you wish to just to drop us a line on info@embryoclinic.eu. I can give you complimentary consultation on implantation failure, but you have to be a little bit patient because it will take a good 20 to 30 minutes.
Excellent. Thank you so much. And let me just remind you that if you could, you can also drop an email with this link I have just sent, and this will be forwarded to Dr. Tsakos and his team, so they will be able to get back to you and provide you with more details indeed. So thank you. And now let's go to the next question. That's fibroids inside the womb affect egg donation outcome?
Hi, say absolutely yes is the answer. I mean, one of the factors of implantation failure is related to the endometrium, which is the part of the uterus in which we implant the embryo. So one of the tests that we need to do really to exclude any pathology is a high resolution scan, but also some sort of contrast evaluation of the uterus, and if in doubt, a hysteroscopy. So if there is a submucous myoma or a polyp, then in my opinion, that has to be removed in a way that ensures that the endometrium remains nice and normal. We do need a normal endometrium, a normal lining of the uterus before we do any embryo transfer, whether it's own eggs or donor eggs.
All right, perfect. I just added because it's a very similar, of course, question with additional information. And now let's go to the next question here. Can you please tell us what is the age limit for the using own oocytes and eggs? So which point the clinic would refuse the use of own eggs and would recommend to go only for donor eggs?
Sure. Hi, Nicoletta. Depends on the clinic is the answer. Legally, we can treat anyone with their own eggs up until the age of 50 or up until the age limit of each country. Now, in my opinion, I don't think it's a matter of age, as it is a matter of individualized history. So, for example, I do have 35-year-olds who've had multiple own eggs failures who went into egg donation in order to become mothers. So in my opinion, it has to be individualized. So depending on the situation, depending on other factors, depending on the history, depending on whether they've tried before and failed or not. In general, I can give you a very, very important piece of data. And please correct me, anyone, if I'm wrong. I mean, I think 45 to 46 is possibly the upper age limit over which it is very unlikely for anyone using their own eggs to be successful. However, I don't think we can refuse treatment. In my opinion, unless there's another risk factor, unless there's another adverse factor, unless there's other confounding factors, if we do proper counseling and if we counsel our patients correctly, if we quote the right numbers, if we share our worries, our anxieties, not only with regards to the success or not, but also with regards to the outcome of that pregnancy, I don't think we can refuse treatment. I mean, even the 46-year-old who delivered with her own eggs, I'm sure she has been refused treatment by many clinics before she was successful a few years ago, and that was published. I think there's a 47-year-old somewhere in the globe who is going to get pregnant in 2020, and she will be published somewhere, and then the boundaries will be pushed forward. I think we have to be close to our patients, and I think we have to look after our patients more than we look after our results. I mean, of course, we're thriving for results. And of course, I do know that some clinics, in their own minds, they refuse or they reject patients because, of course, having a failure is not looking very good on paper and so forth. But in my opinion, we should not be refusing unless there's a risk, and we should be just consulting, suggesting, advising, and definitely supporting our patients. And it's not a matter of age, but it's a matter of individual circumstances and understanding.
Excellent. Thank you so much for all those details that you have just provided on that. Very important indeed. And yes, it depends. Actually, someone has added that was refused at 43 to use own eggs. So I guess it is definitely depending on the actual patient, but also the clinic. All right, and let me go to the next question right here. So what are the actual success figures for mid-30s age group where male fertility is a factor? My husband has low sperm count. What would you be able to offer us?
Sure. Again, I mean, mid-30s could be someone who would produce 15 eggs and someone who would produce 2 eggs. Mid-30s is someone who may have a fibroid in the uterus, who's never going to get pregnant, or someone with hydrosalpinx that she doesn't know anything about it and who may not get pregnant, or who might get pregnant and miscarry or have an ectopic. So in my opinion, I think it's very important, again, to individualize. I think we need to ensure that standard factors, I mean, I had a 32-year-old yesterday with a DNA anomaly who had 2 biochemical natural pregnancies. They came for IVF, and we did karyotype. Most people would not do karyotype before they embark on IVF, and they have a DNA abnormality that would be incompatible or that would reduce greatly the chance of pregnancy. So I think we all have to agree. I mean, and agreeing with our patients is easier than agreeing between ourselves. There is, in my opinion, there's 2 schools. I've been around for about 30 years, and I've been fortunate to meet representatives of those 2 schools. One school doesn't investigate much, if at all. So, standard investigation, viral screen, 1 scan, and off you go with IVF. And the other school that heavily investigates. So you have a standard couple at 35 years old with male infertility, and you would do every test under the sun. You would pay thousands of pounds before you even started using the first injection on IVF. In my opinion, both approaches are probably incorrect, and I think we should be individualizing depending on who is the patient that we're dealing with. So in the mid-30s, in the normal mid-30s, I'm not going to go away without answering, don't worry, Sam. In a normal, standard, well-investigated or essentially investigated lady in her mid-30s with a mild fertility count, I would expect a pregnancy chance of anything between 40 and 50% minimum. Now, again, the question is, how do we define success? What is success? Is it success per embryo transfer, or is it success per exhaustion of all the embryos from 1 embryo transfer? Again, this depends on whether we implant 1 or 2 embryos. So at mid-30s, I would definitely implant 1 embryo at a time. And I would hope from the mid-30s, I would hope to get a minimum of maybe 3 to 4, maybe 5 top embryos. Now, 4 million sperm count for an ICSI technique, and provided there's no associated factors in the male, provided that there's no DNA anomalies or there's no other adverse factors, would give us very good fertilization. I mean, with ICSI, we would expect, having used ICSI on good quality eggs of a mid-30s woman, we would expect a good fertilization rate in the region of maybe over 80–90%. So a mid-30s lady with the lowest sperm count of 4 million, I would expect them to get pregnant really with 1 round of IVF, especially if we exhaust all the embryos that we would collect.
Excellent. Thank you so much again for answering. And if you could repeat the email address you have provided, because someone has asked about that.
Yes, it's info at embryoclinic.eu.
Oh, okay, perfect. Thank you so much for confirming that. Someone has actually wrote this in the chat section, but I wanted to make sure it's the right one. And well, let's get ahead with the next question right here. So I am turning 41 this June and my AMH is 0.739 and follicle count is 6. I am not ready to be pregnant yet. Would you suggest freezing the embryos? How many do I need to freeze and how many IVF do I need to do?
Sure. Hi. Absolutely, yes is the answer. I would, and thank you for suggesting embryos as opposed to oocytes. So, 41 with a follicle count of 6 and AMH of 0.7 is good going. I mean, if everything else is optimized, yes, I would suggest to go ahead and freeze embryos. Now, how many is depending on the quality. And of course, this is a question to be addressed and answered after the first round of IVF. So, depends. If you're lucky enough to produce 2 to 3 top quality embryos, I would suggest maybe repeating it once more would give you a higher chance. But even one embryo, one top quality embryo at 41 is better than one top quality embryo at 42. So bear that in mind. So my suggestion would be to carry on, have the IVF, freeze the embryos, see what they are, how many and what quality, and then of course discuss again and decide if it's worth repeating the procedure when you're still 41.
Perfect. Thank you so much once again for this. And there are plenty of questions coming up. So let me go straight to this one. What is the age limit for the treatment, and do you have brown color skin for egg donor? Is it possible to know the price?
Sure. Age limit for recipient at the moment is 50 plus a few months. If somebody is just over 50, we can still treat them with the new regulation that came out through our health authority. Now, brown skin, of course, is different shade of brown. Depends. The answer is possibly, but again, if you wish to know the exact possibility, you would have to send us some top quality pictures to be able to elaborate on that. Now, prices, I would prefer not to quote prices online. However, bear in mind that they're about 50% less compared to the UK. And if you wish individualized price list, please send us an email, and I'm sure my coordinators will answer that. And please make a note that we do offer 2 packages. And for some couples, the mini IVF package, which is the price is very similar to standard IVF with own eggs, can be quite tempting and can make the egg donation financially feasible. So please drop us a line and we'll answer that.
Excellent. Thank you so much once again. And so, well, there are some questions about legal framework. So, can you tell us what is the legal framework for single women? Is it true that women should have some declarations from notaries from home countries or embassies that they are single? Why is this document needed?
Sure. Hi, Nicoletta. I'm not sure what you mean, but no, you're not required to have any declaration from your own country. So there's a very standard legal procedure. You have to declare yourself that you're single, and then for the benefit of the child, there's a notary document signed by yourself in front of a notary, and all this can be organized by the clinic, and actually it's quite simple and quite inexpensive. So by declaring before a notary that you're single and you take full responsibility for the unborn child, then that should suffice. In terms of cost, this is fairly inexpensive. I think it's in the region of £150, and it takes about an hour in terms of time. So quite straightforward.
All right, excellent. Thank you for clarifying that. Well, there is another question from Nicoletta, okay, a bit longer one, but if you could take a look. I am in a relationship with a man who, because of some peculiar issues, is in the process of divorce, but not yet divorced. Divorce in some countries may take a while. When I contacted a clinic in Athens, I was told that he cannot provide his sperm and I would have to use a sperm donor because according to Greek law, he is supposed to be either single or divorced. That was extremely unusual since no European countries required this. Given that I may need the donor embryo, I am not super keen on double donor embryo.
Sure.
Anything
sure.
you can
Yeah, sure. I confirm that the clinic was right. This is exactly the situation. So you cannot use a sperm sample for someone who is legally married and not legally divorced. So I confirm that this is the case in Greece. This is the legal scenario.
All right, I understand, of course. Thank you for that clarification.
I mean, of course, some
As
other
well.
countries may have different rules, but I mean, I confirm that this is the situation in Greece.
Of course. So nothing that could be done, of course. It's the law. You cannot change that. Okay. Thank you. Next question, a bit longer as well. So let's have a look. What is your opinion on having one last go with my own eggs? I am in my 50s, AMH is 0, went into menopause last year. Over the last 16 years, I've done 10 IVFs, resulting in 3 miscarriages with my own 8 cycles. The 2 donor cycles didn't result in any pregnancy at all, although she gave 5-6 families twins. I would use a surrogate this time. Would you recommend trying with an egg donor again? I don't want to waste more money than we already have trying rejuvenate my ovaries if the result will be 0.
Yeah, sure. Hi, Angela. Well, very difficult. I'm sorry to hear all this and read all this. When you say in your 50s, do you mean, well, I know you can't answer. Anyway, it makes a difference if you're 51 or 55. I mean, the chance of success with your own eggs, even with a surrogate, is, I would say, virtually 0. And given the fact that you've tried so many times and you're going on the surrogate route, um, I think, obviously, this is not something to be answered. Yeah, 53. Definitely egg donor, in my opinion. Definitely egg donor. And of course, I'm not sure in which European country you would be accepted at this age. So if you were, I would suggest that you move on to egg donation, really. Now, with regard to rejuvenation, again, we could dedicate a whole seminar. We don't practice rejuvenation, although my department is quite keen and quite well trained in all sorts of interventions and endoscopic surgery and so forth. Rejuvenation, in my opinion, has not proven itself yet. I do know that a lot of people perform it, but I don't think the evidence until now is enough that is allowing us to use it in everyday clinical practice. So if used, in my opinion, it should be used in the context of clinical trials. And of course, if those clinical trials prove it to be safe and effective, I promise you to be amongst the first ones in the world to use it as well. So, I know a lot of people are doing it, but I think it's the jury is still out as to whether it's effective or not.
All right, thank you. And actually, there's a follow-up from Angela. So what about nuclear and spindle transfers? Anything you can add on those?
Again, it has been performed in Greece, in Athens. I happen to know the scientists who performed that, and there are some amazing people. However, it's still in the context of clinical trials. So, in my opinion, as a rule, we should, be a little bit guarded about anything that is not fully clinically available yet, and it's under trial. I think in your case, and I'm sorry to be a little bit personal, but in your case, even more so, even if you had been 40 or 45, with your history, I think it's probably a matter of of changing the odds by using a method that could be more successful and definitely more safe for the offspring.
Okay, thank you once again for clarification. Next question is up right here. We heard at yesterday's presentation that in Portugal there are non-anonymous legal requirements for the donors. Is there any chance that Greece would agree so that as well due to ethical issues when the kids turn 18?
I'm not sure I understand. So, are you saying I'm not familiar with the Portuguese legislation, but if the question is whether in Greece non-anonymous donation will be allowed, the answer is I don't know. I don't know. And if I were to guess, I would say that it's unlikely.
Okay, but of course, no rumors about that. I mean, in Greece, yes, regarding to non-anonymous donation.
Well, yes. I mean, the word is that neither patients nor doctors are very keen on non-anonymous donation. One of the issues associated with non-anonymous donation, as you know only too well in the UK, is that the availability of donors may drop overnight. Why? Because very few donors would move forward to become donors if their anonymity could be lifted a little bit further on down the lines. So at the moment, to my knowledge, most of European countries, most of European Union countries, they do rely on anonymous egg donation for their egg donation programs.
Yes, thank you so much again for that clarification. And so there are two questions in regards to donors. So what is the age limit of your egg donors?
Legally 35 in Greece, in my clinic 30.
Okay, excellent, thank you. And another question, so how do you find donors in COVID-19 period time?
So you would be amazed to know that when the clinic shut down, we had an amazing number of donors, old and new ones, ringing up and asking how they could offer and if they could offer uh, egg donation. Uh, they felt very sorry and very bad about couples who were counseled and all that. Of course, we couldn't accept anyone during those times. So, there's a lot of sensitivity. There's a lot of sensitive issues um, surrounded surrounding the egg donation process and the egg donation program. So it hasn't affected. I mean, since we opened, we had the standard flow, if not a little bit bigger flow of potential egg donors coming forward. Of course, they do understand the implications of the COVID situation. There's a lot of more forms to sign, a lot of more compliance documents, and a lot of more testing. So apart from that, it's just continuing as normal.
Okay, excellent, thank you. And actually there is a follow-up. So do you have donors from the Caribbeans?
I'm afraid no, we don't. Occasionally we do have, or we may have, some Caribbean residents in Greece, but especially in the north of Greece where we live and where our clinic is, this is very rare.
Okay, understood, of course. Thank you once again. And there are several questions, like three of them. How many embryos do you transfer? What is the best solution for a good treatment?
Well, definitely one is the answer. Well, I'm not sure if you are asking about egg donation or own eggs. With egg donation, definitely one is the answer. One embryo at a time. With own eggs, IVF depends. By law, we can only transfer up to one or two, up to the age of 40. However, if somebody is between 35 and 40, and if they've had more than two unsuccessful IVFs, then we can transfer two or more. In my practice, we tend to transfer one embryo in the egg donation program. unless it's specifically requested and after heavy counseling, unless the couple requires a different solution, which is 2 maximum. I do know that some, mainly non-European countries, they do transfer 3, even in the egg donation program, which is illegal in Greece, we can't do it. With own eggs, depends. I mean, depends on the quality, depends on the age, depends on the history, depends on whether the embryos are PGT tested or not. But the general international trend is not to transfer more than, definitely no more than 2.
Okay, excellent. Thank you for clarifying that one. And let me go to the next question. Is there any reduction for the second and third IVS at your clinic or in Greece in general, I guess? What is the average price for an IVF procedure? Are the medication included in this cost?
So, Nicoletta, you'd be better off sending an email to our coordinators, and they should be able to answer that. There's definitely a reduction for the second and third IVF. However, please bear in mind that prices are individualized and individual in every clinic, and definitely in my clinic, we have kept our prices steady in the last 7 years, despite the sterling drop and so forth. So there's very little leeway, very little margin for reduction, but definitely we're very personalized in the financial aspect. Now, medications are always excluded, of course, in any clinic from the cost. However, we are working very closely with some online pharmacists in the UK, and we have secured some generous reduction for the drug prices on the drug prices for our patients. So again, if you wish a quote, please send us drop us a line, and we should be able to quote that.
Of course, thank you again for that. And there's another one. Do you offer a guarantee in terms of the number of embryos?
I presume you're talking about egg donation, Andrea? Yeah. I presume
Yes.
you speak about egg donation. Yeah, in the full egg donation program, we guarantee 10 top quality eggs. So that's the minimum. In other words, all the eggs of an egg donor. Sometimes we have 14 or 16 eggs. I mean, we've had a case in the UK who, produced nine blastocysts, and they got pregnant first time, and we had 8 spare blasters after that. So, in the full egg donation program, we guarantee at least 10 eggs, and this guarantees a minimum of 3 top quality blastocysts, which is enough for 2 to 3 transfers with a cumulative pregnancy rate of more than 90%. In the mini egg donations, so we can guarantee the eggs, but in the mini egg donation, we guarantee 5 eggs, minimum 5. Usually or invariably, we have more than 5. I mean, I do know of egg donation programs in Europe where the full egg donation program is 6 eggs. So even if somebody opts for a mini program, they may get 6 eggs, 5, 6 eggs. So out of those, again, normally if there's no major issues with sperm, we normally produce 2 to 3 top quality embryos. And again, that would be enough for 1 or 2 goes with an overall chance of very near 9%.
Right. Excellent. Thank you.
I mean, I have to add here that in the full program, if we produce for any reason 2 embryos, which is very rare, it happens in less than, I would say, 5% of cases, then we offer the patients the option to cancel the cycle at no cost, and then we recruit another donor.
Okay. Thank you for clarifying this. And another question you kind of answered, because of course it's about the age limit in Greece, so it is 50, right?
Yes,
but anything you could add? Does your laboratory collaborate with other clinics which have an extended age limit?
Okay, the answer is yes. Although we have to stress here that transportation of embryos can only happen within the European Union freely. So, for example, in Bulgaria, I do know that some clinics they have an age limit. Well, in Bulgaria they do have an age limit of 52 to 53. Bulgaria is within the European Union, so transplantation can happen. However, transporting outside the European Union could be very complex. It requires a special license by our health authorities. This may take a very long time and could be quite troublesome. So we discourage people from considering transporting embryos outside the European Union overall. So again, this is something that has to be discussed individually. But please bear in mind that transporting genetic material within the European Union, it does not require a license at all. So it's quite free and straightforward and commonplace.
All right. Thank you again for answering this question. Next one is actually about the cost. So I guess it's best to contact your team and they will be able to get back to you. Okay. As I can see, you
just bear in mind 30 to 50% less than the UK as a general figure.
All right. Thank you. Next question is right here. So my vitamin D level is 69 nanograms. I think my GP said it was too high, but the fertility clinic said I should continue to take vitamin D. How do you explain that?
I can't. I can't explain that. What I do, well, in general, we like vitamin D in fertility and in life generally. I mean, vitamin D is quite fashionable, has been fashionable for the last few years. However, I'm not sure about the reliability of the test as high as that. So in my opinion, I think you have to discuss with your own GP and your fertility doctors. Personally, if I were to judge that 63, I would probably repeat that because it looks a little bit too high to be reliable, especially for a UK-based
All right.
person.
Okay.
And that's simply because of lack of sunshine. That's simply because of lack of sunshine, not for anything else.
Of course. Thank you so much. And there are two very similar questions, so let me just show you. So first is, how many days of stay in Greece would I and my husband need for treatment with you for ICSI? And I'm based in UK. How many visits will I need to make to your clinic during the IVF procedure?
Sure. Visits is 1 or 2, depending on your wishes and individual situation. So 1 or 2 visits is possible. I mean, we can do the whole treatment within 1 visit, provided, of course, that we identify some providers locally, and we do have collaborations throughout the UK, so that could be easily organized in general. I mean, I've been fortunate enough to have worked in all parts of the UK, started in the southwest in Bristol, then moved on to the southeast in the Norwich and Cambridge area, then up to Newcastle and now Manchester. So I think I do know a lot of nice people all over England, and of course North Wales, where we do have some amazing collaborations. So 1 or 2 visits, depending on your situation and depending on your wishes. And then in terms of the IVF treatment itself, if it's own eggs, anything between 7 and 14 or 18 days.
Perfect. Thank you once again for this. And we will be slowly finishing. So there are like 3-4 questions. So I guess we can go ahead with those. But if you have any questions left, just go ahead and type those in. And as we will be just simply finishing very soon. And so if you can look at this question, what is the definite differences between IVF in Greece and Turkey when making a choice? Anything you can advise?
To be perfectly honest, I haven't visited a single IVF unit in Turkey, although I do visit Istanbul quite often. It's one of my favorite places. So I wouldn't be able to give you, answer to that. In general, I would say that I can talk about Greece. So Greece is within the European Union and within Europe. Greece is a very safe country in terms of conflicts, in terms of crime and all that. It's easy access. It's closer, nearer to the UK than Turkey is in general. And in terms of egg donation, we have very strict rules, as I said. In our clinic, we use very, very young donors, which makes a lot of difference, in my opinion, in the success rate, but also in the quality and the outcome. Now, price-wise, I'm not sure. I don't really know what are the prices in Turkey, but of course, this is something for you to compare.
All right, thank you again for that. And next question is: do you advise embryo glue? What is the percentage to increase total treatment, or do you only suggest that for some cases?
Sure. I'm very fortunate to have been working with David Gibbon, who is a UK embryologist and friend of mine for the last 30 years. So he would be the best person to answer that. But through the education that David has provided me over the last 30 years, we worked together for many years in the north of England, and now we're working together at the Embryoclinic and also in Manchester. I leave it up to the embryologist. That's the answer. I mean, there are some indications depending on the history, depending on the quality of the embryos, depending on patient wishes and all that. I mean, at embryo clinic, if we decide to use the embryo glue, the embryologists are the best person to decide on that. It's free of charge. We don't charge it because we feel that anything we can do in the lab, like we don't charge assisted hatching. So, for example, if we feel that we need to do it and it's in the lab and it is accessible, we would do it to increase our chances. So I'm sorry I can't answer directly. In my opinion, I think this is up to embryologists to decide, and if they do decide to use it, they just go ahead and use it. And of course, you're informed and you consent to that prior to applying it.
Excellent, thank you. And actually, you can see that. Do you want me to give me? I just show you this. Okay. Um, I guess that's okay. You can go ahead and do it, of course.
Sure.
And
Yeah. Dave Gibbon. Yeah. Whoever wants. I mean, Dave Gibbon. Hi, David. Thank you for listening. I'm sorry we had the connection problem. Dave Gibbon is the guardian angel of all our UK patients, whether you're in York, whether you're in Torquay or in Bangor or Shropshire or wherever. You can ring Dave. Dave is there to support you from anything embryology, anything travel, anything logistics. So, if you want to talk about embryo glue, I'm sure that David can give you a free consultation on that.
excellent. Happy to hear that as well. Then thank you, David, for that, and good to hear for sure. Okay, and as I mentioned, we will be slowly finishing. However, there are like few questions left, so let's go ahead with those. If you could take a look, is there a quarantine period of 14 days which is required for people flying into Greece? Do we need to stay at the hotel or Airbnb before going out to embark on an IVF cycle?
No, the answer is no. Not at all. From the 15th of June onwards, you can fly into Greece freely without the need to quarantine. However, depending on the country of origin, you will be expected to take some random testing. So I think by the government, by the Greek authorities, before leaving the airport area. So my suggestion, my advice would be, if you decide to fly into Greece, have a PCR test at home just to ensure you're not an asymptomatic carrier. If you've had this test, keep the result with you. So if you're picked out to have a random test, you can show the authorities the test you've already had done, and you may be excluded from that. Or even if you are included into that testing, you have ensured that you're going to be negative. So there's no quarantine for anyone traveling into Greece, even from so-called high-risk areas like the UK, Italy, or Spain.
Okay, excellent. Thank you once again. And what about NGS? Is it decreasing quality of embryo?
Again, I think Dave Gibbon is the best person to talk to.
Okay.
Please drop us a line to info@embryoclinic.eu, and I will offer a free consultation with David. What I have to say is that because of its unproven benefits, in Greece, we need a special license to perform NGS. So in other words, if you're 35, we can't try to sell you NGS. I mean, you can understand if you've only had one cycle. So the specific indications for NGS, in my opinion, it shouldn't be applied freely on anyone. Particular indications include advanced female age. So, for example, someone over 40 might have an indication in order to ensure that the DNA is normal and the embryos are DNA intact, or anyone with repeated implantation failures or miscarriages. So it's not a panacea, it's not one size fits all. It's not, in my opinion, an add-on that should be considered by someone who's embarking first time for IVF unless they have specific indications for it. Does it decrease the quality of embryo? This is again a huge debate. In my opinion, if it's performed by the right people and for the right patients, I think it is worth performing it, but it's not for everyone and anyone, and it shouldn't be just widely used as a standard add-on for IVF service.
All right, perfect. Thank you so much. And we have like one very short question. Do you offer Pixie as well?
Again, please speak to Dave.
Okay. Excellent.
Because we do individualized, there are some issues associated with Pixie, but I think an experienced embryologist is the person to answer whether it's worth considering or not.
Excellent.
Pixie, depending on your individual circumstances.
Of course, that's not a problem. There's actually another question about embryoscope, so I guess another question to David as well. Well, we will be finishing, and well, I will definitely make sure that all the questions have been answered. So I just see that all those are regarding the embryoscope as well. So what we can do, I will be happy to simply forward your questions to Dr. Tsakos, and he will be able to also get in touch with you, I'm sure. And if you have any questions left, of course, remember, you can use the link. I will send it to you once again, and that way you can also get in touch with the team, Embryoclinic team. And as you know, this has been recorded, so you will definitely have a chance to watch this again. And well, I would already like to thank you, Dr. Tsakos, for joining our webinar tonight. We are happy that it worked. So thank you so much for being with us, for answering all the questions. I can only say thank you, and it's always great to be able to host these webinars with you. As you can see, there are some nice comments right here as well.
Thank you so much. Thank you, Caroline. Thank you, everyone, for staying with us, and thank you for listening. And wish you to stay safe. Listen to your countries and governments' guidelines. They know better than we do. And let's hope that in the next few webinars, we're never going to mention the C word. And we're going to move forward with optimism, with hope, with sincere counseling, and with good and safe experience and good results. Thank you.
Excellent. Thank you once again. And just to let you know, okay, as I mentioned, we need to finish tonight, but of course I will send those questions that haven't been answered, and I'm sure the team will be happy to get back to you. And also, just let me remind everyone that you will be able to find this video on our myivfanswers.com. If you simply subscribe to our YouTube channel, that way you will be notified when the new video is uploaded. And well, I can only encourage you to join our next IVF webinar. It starts at 8 p.m. UK time, so very, very soon. We have another topic to discuss. So I'm sure it will be quite useful for you. This time we will go to Spain. So hope you can stay tuned with us. And once again, huge thank you, Dr. Tsakos. It's always a pleasure, and have a lovely evening, and take care.
You too. Take care. Good night.
Thank you. Bye.
Bye-bye.